have heard the results of the COMPARDS trial presented by Dr. Robert Motzer from Memorial Sloan Kettering Cancer Center. This is an international randomized trial evaluating head-to-head two oral angiogenesis tyrosine kinase inhibitors for the treatment of patients with metastatic renal cell carcinoma that have had no prior treatment. The aim of this study was to prove in a head-to-head fashion whether or not Pazopanib was actually non-inferior to sunitinib. The results of this study are really quite fascinating. What they showed, first of all, in terms of progression-free survival, the primary endpoint, the hazard ratio is 1.047 with an upper boundary of 1.22. So Pazopanib was clearly not inferior to sunitinib. When they looked at overall survival, Pazopanib was not inferior and was similar to sunitinib. When they looked at response rate, Pazopanib was very similar, or maybe even a little better, but very similar, let's say, to sunitinib. The P was 0.03. In terms of safety, which was very important, there were different safety issues with the two drugs, and they have different safety profiles. Sunitinib had more fatigue, more hand-foot syndrome, and more mucositis, whereas patients on Pazopanib had more liver function abnormalities and hair color changes. The hair becomes white. Quality of life was a very important part of this trial, and 4 different quality of life instruments were used, and in almost all areas looked at, Pazopanib seemed to have a better quality of life than sunitinib. The first data on Pazopanib, where I was the principal investigator in the Pazopanib trial, it was compared to placebo, showed a progression-free survival of 11.1 months, which was very similar to that shown in the phase 3 registrative trial of sunitinib of over 11 months. The Pisces trial looked at patient preference, and in that trial the patients preferred Pazopanib over sunitinib and the physicians preferred Pazopanib over sunitinib. But having said that, this was a very small trial, and the reasons for their preferring Pazopanib had to do primarily with fatigue, and those who preferred sunitinib, there wasn't any one specific reason. So now we have a third trial, the COMPARDS trial, the one which I think is a more definitive trial, comparing head-to-head the two drugs, showing that they are very similar in efficacy, very similar in progression-free survival, overall survival, response rate. They have different safety profiles, and the quality of life seems to favor Pazopanib.